Since just last month, early September, Montana has seen 36,000 new cases of COVID-19 and more than 300 deaths, as well as hospitals packed with patients sick with the virus. So how is Governor Greg Gianforte's administration responding to this COVID-19 surge? MTN Chief Political Reporter Mike Dennison spoke to people who worked closely on the issue both this year and in 2020 when Governor Steve Bullock was in office. Now, in the second of his two-part series, he also talks with the governor's top public health official about the administration's efforts and some criticism they've faced.
As of Friday, nearly 500 Montanans are hospitalized with COVID-19, more than quadruple the amount of just 10 weeks ago. Adam Meyer, the Gianforte administration's top health official, says it's been all hands on deck to help hospitals and other facilities meet the challenge.
We've worked directly with a number of hospitals on helping identify availability of staffing contractors to bring on additional, whether it's clinical staff or non-clinical staff.
Rich Rasmussen of the State Hospital Association says the administration has delivered on things like assigning the National Guard at hospitals, making it easier to find more beds, and helping find and fund more staff. Meyer, however, says the most important step is one that only individuals can take: get vaccinated.
The ticket out of this is really getting these safe and effective vaccines, and that's why we're so focused on this.
The Gianforte administration is continuing to run public service announcements urging people to get vaccines. But some public health officers say the Gianforte administration undercuts that message by signing and supporting the state law that prohibits any vaccine mandates in Montana, even by private businesses.
The message that there will be no mandates, I'm going to fight the feds for any vaccine mandates, I think undermines any other message about, talk to your doctor and get a vaccine.
About 49% of Montanans are vaccinated against COVID-19, among the lower rates for states nationwide. Public health officials also note Gianforte signed several laws that restrict what local public health departments can do in response to communicable disease outbreaks. Meyer says the Gianforte administration doesn't believe the government or other entities should mandate personal health care decisions on vaccines. He calls the governor's actions a balancing act that takes into account other interests when it comes to public health.
There's more limitations as it relates to public health response, but there's also additional freedoms and liberties that people are enjoying. So we're balancing the competing interests, and I think generally speaking, people are supportive of the ability for people to continue to maintain freedoms and to have employment and those sorts of things.
The administration also issued a controversial emergency rule in late August that said school districts should allow children certain exemptions from requirements to wear face masks. 18 state epidemiologists and health experts wrote a memo to Meyer 2 weeks later, saying statements supporting the rule were misleading or false. Former state epidemiologist Jim Murphy, who left the agency in July, also says they were discouraged from taking another mitigation action in schools this fall.
Typically, for the start of a school year, there's a pretty heavy effort to vaccinate kids for the routine childhood diseases, and a lot of that occurs in school settings with school-based clinics. Yet we were discouraged from promoting anything similar to a school-based clinic with COVID.
Meyer says he doesn't recall making that directive, and that the emergency rule was merely to provide a legal framework for students to get a mask exemption if they needed one. Former state medical officer Greg Holtzman told MTN News he believes state health officers are doing all they can to mitigate the COVID-19 surge, but that frontline workers are discouraged.
Last year at this time, we all had that little light going, oh, a vaccine's going to come, we're going to get immunized, things like. And so I think a lot of providers right now that I talk to, colleagues of mine, they're exhausted and they're also wondering, when does this end?
Cases are starting to decline nationwide, and Meyer says he's hopeful Montana will soon follow that trend. But as of Friday, we're still one of the hotspots in the country for COVID-19. Reporting from Helena, Mike Dennison, MTN News.